This skill requires 2 EMTs. EMT number 1 should manually open the patient's airway from the side, while EMT number 2 assembles and prepares the BVM, including attaching it to oxygen, from a position at the top of the patient's head. Then, EMT number 1 should insert a properly sized oral or nasal airway as tolerated. Proceed by holding the bag portion of the BVM with both hands. The mask should be sealed by EMT number 2 by placing the apex of the mask over the bridge of the patient's nose and lowering the mask over the patient's mouth and upper chin. Continue by placing the thumbs over the top half of the mask and the index and middle fingers over the bottom half. If the mask has a large round cuff surrounding the ventilation port, center the port over the patient's mouth. EMT number 1 should squeeze the bag slowly and steadily to deliver the breath over 1 second until the chest rises. Maintain the airway by using the ring and little fingers of EMT number 2 to bring the jaw up to the mask and continually evaluating the chest rise. EMT number 1 continues to ventilate once every 5 seconds for adults or every 3 seconds for infants and children.